Hi everyone, I'm Deborah Hart, nurse practitioner, owner and operator of First Impressions Rejuvenation Clinic. We have two locations, one in Sydney, Nova Scotia, the second in the Halifax Regional Municipality in Bedford, Nova Scotia. So you can find us on George Street in Sydney, as well as 9 Mile Drive in Bedford. We have a relatively large complement of staff here to help you with all of your needs. Nurses, clinical and medical estheticians, laser technicians, registered massage therapists, as well as, of course, nurse practitioner. We offer therapies ranging from skin health to vitality, wellness, sexual wellness, skin health. We treat symptoms such as rosacea, hyperpigmentation, acne. We treat the signs of aging as well as help to not only minimize the signs of aging, but to restore and enhance so that we look much more like our younger, revitalized selves. At the trade show today, what we will be doing is answering any questions that come along as they come along. I will be looking to the chat box to see and maneuver. I'm a nurse. I'm a little more technically challenged in all things Facebook Live, but I'll do my best to answer any and all of your questions. So please feel free to put them in the chat box. Send me some love, a couple of little emojis. I'm pretty partial to the smiling faces, maybe some lips, but as well feel free just to say hi, just to observe, or to ask any questions that we can help you with today. Our job here is to provide you with amazing value and amazing care. We're here for you, and we're here to help you address your concerns, whether they be with a more mature aging process to enhance the look of your skin, the texture of your skin, the color and tone of your skin. As well, we help with wrinkles, sagging, when we look tired, and just to help us look and feel like we're more ourselves, more revitalized, more refreshed, restored. We do treatments from head to toe, not just skin care and injectables for the face, but we also do facials and chemical peels. We do hair restoration. Some of us have, as we get older, some of us unfortunately, when we're younger, have issues with hair loss or thinning hair. We do hair restoration for those people with wonderful results. We also do hair removal for those places that we have decided we no longer want to shave, and perhaps a more permanent hair reduction procedure is more appropriate for us, saving us those hours of shaving and the costs associated with razors. We also do fat loss, fat reduction, as well as acne treatment and hypertension. There's my primary health care days going back to me. Hyperpigmentation. We do treatments for sexual wellness, both for men and women, and we also help with urinary incontinence in a non-medicine, non-surgical way. And we can talk a little bit more about those as we go. What we have found is that most women, in particular, men as well, but most are frustrated with their skin. They're frustrated with how they're looking, how they're aging, worry that we're going to continue to look a little more tired, angry, saggy, old, and don't really know what to do to help minimize these signs of aging or to help correct what's bothering them. What we really want is to look less tired, to look less angry, get those little angry lines gone, to look a little less saggy, and to look and feel a little bit more refreshed, relaxed, uplifted, and confident. What we often end up doing is buying more creams, other creams, more expensive creams or lotions, and thinking that these lotions and potions and other devices are going to help us restore and fix these problems, and unfortunately they're not. The real problem is we only get older if we're lucky, and we just have to take care of ourselves a little differently. We need to address and correct the underlying problems that are causing us to age, and this will help us not only look more refreshed, but also helps us to look and feel a little bit more confident in our lives and our relationships and in our careers. I have a couple of questions here. Give me just a moment. Hair regrowth. So question for hair regrowth. In particular, this is about men's hairlines. However, the question being about men's hairlines, it does affect both men and women, and the restoration process happens in the same way. We use a technique called platelet-rich plasma, in which we use your body's own repair mechanism in order to repair the underlying issue. We do this by doing a blood draw, very similar to what would happen when you go to the lab and have your blood work drawn. We use a centrifuge and we spin that down, and in doing so we separate our red cells from our white cells. Our white cells, if you remember way back into biology, are our helper cells, our healing cells, our soldier cells, if you will, and they help to heal and repair and assist our body to restore certain properties that it may be having problems with. And in this case, it would be the follicles of the hair. We take the white cells, concentrated platelets, and those platelets we use and inject, in this case, in the hairline or in any of the areas where the hair is thinning. And what this does is stimulates the follicles that are underneath the surface of the scalp to stimulate growth factors and allow that follicle or those follicles to get back into a healthy state where they can start to proliferate and grow and restore itself just that little bit more. So there are many underlying issues that can cause some hair thinning or balding, and of course they need to be addressed and looked at as well, and that's something that we do while we're here for your consultation. But it is using your body's own platelets to restore that underlying problem that allows the follicles to restore themselves, regenerate, and grow. And in doing so, the hair process begins again, or enhances itself, or is enhanced to grow a little faster than it has been. And this process starts that hair growth again. That hair growth has been spectacular. We've gotten spectacular results on our Facebook page. If you have a moment, there are a couple of before and afters, and after each treatment, the hair is restored and growing with each treatment. And what we recommend, because what we know through research and clinical evaluation, is that 3 treatments is what tends to work well for most of us, and usually at about 4 to 6 weeks in between treatments is when we would have you come back and we look at repeating that process. So a series of 3 usually, which of course is something that we would have a conversation about during the consultation, and that series is usually about 4 to 6 weeks apart. For those who are just joining us, we have just finished talking about hair restoration and the process behind that. And that process, of course, was PRP, otherwise known as platelet-rich plasma. And we do a lot of that in clinic for stimulation of our body's growth factors in areas to stimulate things that may have been having some trouble. And one of those, of course, being hair regeneration, hair growth. There are a couple of other processes that we do use platelet-rich plasma for here in the clinic. While we're on the subject, and I don't see another question, I'll continue on that. Again, platelet-rich plasma comes from us doing a blood draw, spinning and separating your red cells from your white cells, using your platelets to restore the areas in the body that need a little extra something, and to enhance the normal pattern of growth factors in our body. Hair restoration, one of them. Another that we use that for would be for skin and face, for texture, tone, scarring. When I say skin, all over the body. We've done legs, knees, arms as well. But a lot of people start with the facial area because, of course, we're face forward. We're face first, and we want to make sure that our skin on our face is healthy and restoring itself to a nice, natural, even tone and texture. When we do PRP with the face, we will often do it in the form of a microneedling, and there are a couple of different avenues for microneedling as well. Note, this is a medical grade microneedling. It's not something over the counter or with your little the little rollers. This is a little bit more intensive, therefore giving you a better result, a medical grade result. With the microneedling, we do a couple of different processes. So platelet-rich plasma on the surface of the skin after and during microneedling, which causes microchannels in the skin, allowing for that platelet-rich plasma to go into those little channels that we have caused microtraumas. And in that sense, the platelet-rich plasma, those concentrated platelets, get in and start to, again, stimulate those growth factors and help the body to restore some of the damage in the skin caused by multiple factors, environmental, personal, lifestyle, etc. There are also other ways of doing platelet-rich plasma on the face and the body, and that is through something called a booster. And in this case, still a microneedling type process where the injectables are causing little microtraumas on the skin, causing the body to come and heal those little microtraumas, similar to how we have a little cut on our finger, and the platelets come and restore and grow that nice new skin for us. It is similar in that process. With a booster alongside of platelet-rich plasma, what happens is those needles now are a little more hollow, like an injectable type needle, and we can put the plasma, the platelet-rich plasma, in through those injected needles, so that we are physically depositing the platelet-rich plasma at specific levels in the dermis to target the areas that we're trying to heal. Again, for scarring, for tone, for texture, acne scarring we do a lot with our PRP, and it gives a wonderful overall texture and tone to the face, as well as to minimize, restore, and often reverse the signs of those scarring. Another wonderful thing about it, though, is that it reverses the signs of aging as well, because as we get older, our growth factors aren't naturally stimulating the same amount, and our skin processes as we naturally exfoliate and shed that skin. That doesn't happen as quick, and our skin cells start to get a little sticky, a little stubborn, and it dulls our skin, sometimes clogging our pores, again changing the texture and the tone of our skin. And the platelet-rich plasma, of course, comes in, speeds that up, makes our body think that it's undergone a very big trauma, for lack of a better, and we've taken those platelets and put them in that area that we want that restoration to happen. And in doing so, your body gives a big restoration, a big healing sensation to those areas, and restores and revitalizes what it is that we are treating. Also, on the topic of platelet-rich plasma, we do facelifts, non-surgical facelifts with PRP. Sometimes this involves fillers also, but more often than not, just the use of that body's own platelet and concentrated platelets injected into the appropriate areas and levels of the face will help to restore and revolumize areas that we have since lost volume, integrity, tone, and elasticity. And in this way, we can actually give a facelift, the result of a surgical facelift, without the downtime and the potential side effects and consequences, as well as not only does it give that lift, tone as well, but it helps to revitalize the texture and the tone of the skin over top, something that a surgery doesn't do. We use platelet-rich plasma for both men's and women's sexual health also. As we get older, we naturally have changes in our circulation, and this can sometimes lead for women for dryness, irritation in the vagina and the vaginal wall. It can cause some difficulty with sexuality and with sexual intercourse, and it can also cause some issues occasionally with urinary incontinence. With platelet-rich plasma, again, as we say, we're using our body, our natural body's recovery, restoring, and healing properties to correct the any underlying damage or any underlying aging, and injecting in specific areas in the woman's body near the urethra and the vaginal canal. What will happen is we start again to restore those growth factors, rejuvenate those cells, and as these cells are rejuvenating and repairing, we become a little, those cells become a little younger, a little more rejuvenated. And it's that rejuvenation process, again, that helps to increase tone and texture. It helps to increase lubrication. It helps to decrease any discomfort. And it also helps to enhance our sexuality, our sensuality. And another bonus is that as we get older, some of us, our vaginal wall isn't as strong as it used to be, whether it be because we're a little older, because we've had children, because of the natural processes of aging. So, when we cough, sneeze, and jump up and down, those types of things, we have a little leakage, and the PRP in that area helps to restore that as well. So it minimizes and or completely abolishes mild to moderate urinary incontinence. In men, we have similar issues where, again, circulation and tone isn't the same as it used to be as we were younger, and Occasionally what will happen because of either the aging process and or because of some medications or underlying health issues, it can cause a man's erection to not be as firm and or not to stay the length of time that it used to when they were younger. Another thing is sometimes they don't have the same strength that they used to when they were younger as well. Sometimes hormones, sometimes age, again sometimes because of underlying conditions, medical conditions or medications. Again, utilizing PRP, platelet-rich plasma, injected into the glands of the penis. What happens is we start to restore those growth factors again, and this is something that would normally be happening when we were younger, maybe a little healthier, and because that has waned, sometimes the male's erection has waned as well. So in using PRP for male sexual wellness, this helps instead of medication. We've heard of Cialis and Viagra and those types of things. But instead of using those types of medication, we're actually now using the body's own healing systems to restore and treat erectile dysfunction. And that too works quite well. I think one of the only low scores, because of course we do a little bit of research and make sure that we are clinically evaluating our patients as well, always of course enhancing confidentiality and anonymity, but we want to make sure that in all things medicine that things are working and they're working well, and address things that may not be working to our satisfaction. And in some of these scores, we had one low score from one woman who had what we call the O shot for women, PRP, and when we evaluated why that score was low, it was not because she didn't have great results. In actuality, she had such good results that her husband couldn't keep up. So I always like to talk about the O shot for women alongside the P shot for men, because just in case you'd like to make sure that your partner keeps up, we do sexual wellness for both men and women, and but it's interesting to find out why, of course, people are pleased or maybe not so pleased with the treatment, and that one I thought was rather interesting. If there's any other questions, please keep them coming, and in the meantime I will tell you as much as I think maybe you may want to know. So we talked a lot about PRP, and so let's talk a little bit about the process when you come to see us in either location. We're here for you, so we want to make sure that we are addressing what your concerns are, your questions are, and that all of those are answered appropriately. This is Medi-Spa, so it is a medical clinic, and what we do here are medical treatments. So it's very important that when you are considering getting any of these treatments done, that you do seek out a licensed nurse practitioner or physician, and that your nurse and the staff that are working in the medical clinic or the Medi-Spa are trained in medical aesthetics, aesthetic medicine, cosmetic medicine. I always say it's fantastic that we have so many specialties in medicine, but this too is a specialty, and I always say we're very fortunate to have orthopedic surgeons, and they're very well trained, but I don't want them doing my brain surgery. We have neurosurgeons for that, and I don't want my neurosurgeon doing my knee replacement either. And this is a very specific form of medicine, cosmetic and restorative, and in particular the face is a specialty in itself. So please, if you're looking at having these treatments done, please make sure that you do seek out someone who is not only licensed as a nurse practitioner or physician, but that they've also had extended training in this area, because we want to make sure that you're safe and you stay safe. which isn't always the case out there. When you come to First Impressions, one of the first things that happens when you get here is we go through a consultation. In that consultation, we make sure that we go through your health history, any past medical conditions, current conditions, any surgeries that you may have had in the past, and anything that's upcoming. We also go through any medications that you may be taking, as well as any allergies, because first and foremost, your safety is important, and we want to make sure that this treatment is appropriate for you, whichever treatment it is that you're looking for, and we want to be able to offer you a treatment that will assist you with your goals and not cause you any concerns as well. So a thorough consultation, health history, an evaluation of your health, your medication, and any potential concerns that you may have coming into the consultation. From there, we look at what your concerns and your challenges may be. We want to know what it is that you're looking to achieve, what your goals are. These are things that we discuss with you because this is your plan, your treatment plan, and your goals. We're here for you. We want to make sure that we discuss with you how best to get you to your goals, to help you with your concerns, and if there are some of those goals or concerns that we can't meet for you, how to get you to the appropriate places through recommendations and different referrals, should that be the case. So during our consultation, we also go through any individualized recommendations for you. We're all different. We all have different needs. We all have different goals. And those goals are something that we want to be able to discuss with you so that we can set those goals and set your treatment objectives and look at how to get that treatment plan in place for you. Some people elect to have same-day procedures. Sometimes we'll set up procedures in the future, and sometimes we'll do it over designated periods of time. This is something, again, that we discuss while we're in and doing your consultation. What we're looking for is to get you the results that you want, that you have, that you leave looking well, fresh, yourself. Our goal is for you to leave being your best version of yourself, feeling confident and natural. We ensure that you get education on the treatment that it is that you are looking to obtain, as well as education on the treatment that maybe you need. There are so many treatments, and it can be so very confusing that sometimes what we think we need isn't actually it. There's a lot of misinformation on the news and in the internet, and so while I always say it's good to have information coming in for your appointment, we want to make sure that you have the information on the procedure that is going to work for you as well. So part of that time that you spend with us is education on what the cause of your underlying concern is, and education as to what it is that we can do to help you accomplish the goal and get over those challenges and concerns. We talk about individual maintenance plans as well as treatment plans, and for any treatments that we do plan on doing or that we do, we ensure that you have post-care instructions. There's thorough education there, as well as take-home instructions, and we have follow-up usually at about a 2-week period of time depending upon your treatment, and that's always included with the plan of care as well. We want to make sure that you have the instructions and the follow-through to any treatment and any goals that you've had, and as well that you know that you have access to us, whether that be through a phone call, a text, social media, and popping in, because we're here for you. Again, this is a treatment, and this is something that we want to make sure that you feel confident and comfortable in, and that you feel supported in, because that's why we're here. looking to see if there's any other questions there. Feel free to pop me a couple of emojis. Let me know you're still listening. I see a few people popping up, but please feel free to ask any questions, and I most certainly will answer them as we go. They have a little trade show special as well, just to let you know. Our consults are usually $75, and what we're offering today is a free consult. It'll be a virtual consult, and this is done on a confidential medical platform. We've all heard the news on confidential platforms. We do use a medical grade platform here. It's called Teoxane. It's very easy, no muss, no fuss. On your side, it's a quick link once the appointment is set up. And for the trade show special, you have the virtual consult, $75 for free, as well as up to about $100 in skincare products to help you start to address some of the underlying concerns that we have with our skin. In order to do that, what I'll have you do is just go to our Facebook page, and in the messages we need your name, because it's not always the same as your Facebook name, your name, your cell number, and your email address. This is best in this form of a document so that we don't get the numbers wrong, we don't get your email wrong. And just let us know that you're interested in having a consultation. We will contact you via phone or email and set up a time for that consultation, and we'll talk to you about the details of the special a little bit more then. This, of course, in time for any special moments that may be coming up on the calendar. And as well, I will let you know we have our products, our topical products are all online through Facebook, the Facebook store, as well as on our website, firstimpressionsclinic.ca. You can order there and have direct delivery to your home. The other option as well is we've started working with Vivier, and Vivier, one of our skincare lines, has offered our products on vivierskin.com, and if you put in the client number 902-322-6805, you only have to enter it once. That will set you up a shopping site with them, and they will do free delivery, and then you'll get a free bonus topical skincare product from them as well. So it's a wonderful deal. Again, that's vivierskin.com, vivierskin.com, and the client number is 902-322-6805, and that will get you free shipping as well. And just as a side note, that happens to be one of our clinic numbers as well. Should you want to speak to someone here at the clinic or leave a text, the line for Sydney is 902-322-6805. And for those of you looking for an appointment at the Halifax location, the number is 902-702-2727. You can always catch us on Facebook. You can always catch us on Instagram. And probably the easiest way to get to any form of contact whatsoever would be through our website, which is firstimpressionsclinic.ca. Just going to have a little quick run through the notes there to see if there's any more questions. A couple more questions here. Let's see. Lotions and potions. Yeah. So one of the big things I always say, we have so many people come in and saying, you know, it's horrible to get older, it's horrible to age, and it truly is not. We only get get older if we're lucky. We just have to change things up and do things a little bit differently in order to take care of ourselves as we get older. They keep saying, you know, like if all these different scenarios of things that we could be doing, should be doing, and ideally we're trying to avoid the inevitable, which is the facial sinking and sagging and wrinkling. And in order to do that, we need to address what's causing facial aging, and it really isn't what you think. We do many treatments here that address those underlying causes of aging. The changes in our skin tone, texture, and elasticity, the topical changes, tone, texture, sun damage, etc. The laxity, gravity's not entirely our friend, and there are many things that we can do about it. It's not something that we need to suffer through and do on our own. There are lots of possibilities and lots of different things that we do here with great success. Majority of our business is through word of mouth. I'm a nurse practitioner. I'm not a techie. I'm not good at marketing and sales, but we're good at what we do here, and because of that, our business is word of mouth and repeat customers, because we are working with you towards your goals to help you take care of you naturally. Probably one of the hardest things for us in marketing is that people don't know you've been here, because you leave looking good, refreshed, natural. We want to feel good. We want to look good. It's a feedback mechanism. We get up in the morning, I always say, we had a really good sleep. We walk by the mirror, we see we look tired, and that's how our body goes. That's how our day goes. We feel that and we carry that for the day. We could have a very bad sleep on the entire flip of that, and walk in, happen to see ourselves in the mirror, feeling tired, look and say, oh, well, I must have slept better than I thought. I feel better. The shoulders go back, the posture gets better. We go about our day better because we feel better. And that's what we do here. We help you with your goals, to attain your goals, and to make you feel, to help you to feel more your confident self. Whether it be at home, in relationships, at work, we want you to feel confident. We want you to have your confidence back, and we want to help you in achieving that. And I don't think there's any more questions, but please feel free to reach out again via Facebook or any of the other links, and as well take hold of our special. For any questions, we're always here for you. Hope you all have a very wonderful day. Take care of you.